My foot's tingling. Is that normal?
No. What exactly does
And my stomach's killing me. Could this cause that stuff?
No.
This guy's faking. It's Munchausen's. You notice the EMT run sheet? The paramedic who brought him in is also named Martin Harris.
If the name was Attila von Wiener Schnitzel, I'd say you might be onto something.
Look, room 406, abdominal pain. Room 403, left-sided numbness. 402, syncope. He's copying his neighbor's symptoms.
No.
Yeah, coincidence is much more likely than you being a stubborn jerk.
Munchausen's patients create symptoms, not names.
Munchausen's patients have medical histories they don't want us reading.
No laryngeal spasm.
Breathing's resumed normal rate without intubation.
You see, nothing's wrong with him.
He's in a lab coat. Munchausen's pretend to be patients, not doctors. He's got mirror syndrome.
Giovannini's?
Do you know another mirror syndrome? Brain's got no idea who he is, where he is, what he is. So it fills the holes with whatever dirt's lying around. He reads a name tag, he's got a name. Sees a doctor, he's got a job. Sees symptoms, he's got a problem.
My explanation's simpler.
Well, if it's simple, then we discharge the nut bar. But if it's complicated, then the nut bar has got brain damage.
You're sick, so I'm bored.
You ask what's wrong, then you ignore the answer. Just go on with what you're doing. You think everything's okay as long as you don't think about it, don't deal with it. Is that blood?
I think it's pus from a fungus.
I have fungus in me?
If you've been in the tropics in the last few months, I saw this in tsunami survivors. Their skin grafts would ooze black pus sometimes weeks later. Trace the fungus back to the sand and the tsunami tides.
That's so cool.
You okay?
Not okay.
Which one of us is he mirroring?
Well, if it was you, he'd be inflicting pain on someone else, so... I'd say he's mimicking whichever one of us happens to be dying.
His name's Robert Elliott. He's from Hamilton, Ohio.
Here's everything he had in his trunk and his glove box.
No need for the heart biopsy. I now know exactly who he is and what he has. You saved his life.
Really?
No, you idiot. It's paper rub and lunch receipts.
We have his name. We could find his doctor, get his medical records.
It's 8 at night. Biopsy will be faster.
Got it. Pink, good size, nice specimen.
I'm scared.
It's okay. It's gonna be okay.
No. No, it's not.
No, I'm not interested in how he's doing. I'm interested in how she's doing. So get in there and tell me how he's doing.
You think he'll mimic her if I'm in there with her?
You're a powerful, dominating man, but who knows?
So I'm gonna get fired before her.
Yes, you're gonna get fired right now unless you get in there.
Nothing on the biopsy.
And how is he?
His fever's at 106.
I know. But how is he? Bitter? Sexually frustrated?
He's delightful. Loves the smell of freshly baked rhubarb pie and isn't afraid to love. Also, his rash is coming back.
He needs the meds and the tub, just to keep him stable.
Fine, soak him again.
He'll be happy. Loves hot tubs.
No, you love hot tubs. Find the rest of the gang, tell them to meet me at the lecture hall.
Hate hot tubs.
What did you say?
I hate.
He likes. Who else was in there?
No one.
You didn't think to mention that.
The guy likes warm, swirling water. Didn't know that was diagnostic.
It's not. What it is that water hit him and he had a thought. Not about you, but about him. We need to splash him some more. Sure you use this stuff? I use it all the time.
I use it all the time.
Yeah, I just said that. You know, the cool thing about this stuff is you do a lot with it. soften your skin, you treat scrapes, naughty stuff. Why did you do that?
Because it doesn't smell like dung.
You're saying you like the smell?
Not really. Just doesn't smell like dung.
Something else does smell like dung.
Yeah. Dung.
You guys ready? Now is the time you stare at me in slack-jawed amazement. He sells farm equipment. See? Pig lagoons, pig farms. And as every child knows, where you have pigs, you have pig poo. Whereas very few children know, where you have pig poo, you have erythrozyme infection.
We'll start him on clarithromycin.
This time tomorrow, he'll be back to his old self, whoever that might be. Foreman, come here, fast.
What's going on? When are they doing the autopsy?
You're doing it now. You ever studied how they used to do ice pick lobotomies?
I read about it in med school. Why would I?
Shove an ice pick into the eye socket just above the tear duct. Bang it a couple of times with a hammer, get a sample.
What's going on, Hal?
Foreman, you can't do it. You'd be in violation of...
Can't do the time if you're not alive.
You! I need you to suit up. Get that equipment away from Dr. Foreman.
Take your time, guys. You just tell him to go slow. It won't be your fault.
Foreman, we don't even know what kind of contagion we're dealing with.
Which is why we need to chop into the guy's head.
It's dangerous.
Not to you, Foreman.
There are other ways to diagnose you.
Yeah? You have the answer? Foreman, do it now.
I'm warning you, do not...
What are you doing?
I didn't feel right.
He's blind.
He thinks he can see. Same as the cop.
Need something to bag the sample.
Forget it. You just biopsied a mattress.
No, I'm fine. House, there's a sample. Get it. Test it. You gotta test that sample.
Apparently, I was optimistic about the 36 hours. Intractable, unbearable pain is up next. Sure you don't want to reconsider that whole autopsy thing? What type of illnesses affect humans but not rats?
Why are you asking me that?
Because I'm sure that you spent the first 12 years of your life dreaming of being a vet. The rat is not getting sick. Cameron is not getting sick.
Sorry.
It's okay. It's not your fault. Presumably, you're still healthy because whatever it is not bloodborne. Steve has no excuse. He did everything that Foreman did.
Some bacterial infections don't affect rats.
Foreman tested negative for every bacterial infection that would affect his brain.
And what infections could he be positive for but test negative for? When we test for infections, we look for antibodies. And what if the patient is infected but has no antibodies? What if the body is not fighting the infection?
Why would...
I asked first. Let's start with the what. We'll deal with the why later.
If the body doesn't recognize the infection, our tests come back negative and the disease rampages through the body unstopped.
Exactly like the cop and exactly like Foreman. And what if the patient was then exposed to a second infection, like Legionella? The body would recognize that infection, increase the white counts, send in the troops to start fighting, and the initial infection would get caught in the crossfire. So the question becomes, what type of bacterial infection affects humans but not rats, and the human body would be unlikely to recognize? The answer is Listeria. I'm starting you on Ep and Jen.
So you're basing this theory on the test being negative and your rat being healthy?
And the fact that Legionnaires is helping you.
But the medicine you want to give me will put an end to that.
Yeah.
And if it's not Listeria, all the gent will do is cure the Legionnaire's disease and put whatever is killing me back into overdrive.
Stop asking me questions based on the premise that I'm wrong. Antibiotics are in the airlock.
I think the first biopsy didn't give us the answer because you didn't go deep enough. I want you to do a white matter brain biopsy.
Absolutely. Don't blame me. The world is such a complicated place if you've got higher reasoning skills. I'm often jealous of small animals and retarded children. Take the antibiotics.
There can be minimal damage if it's done right. If the surgeons drill where I tell them to drill.
One slip, You could spend the rest of your life not being able to keep your drool in your mouth.
I'd rather be disabled than dead.
Sure, I make it look oh so sexy. It's actually not as glamorous as you might think.
The biopsy will tell us for sure what's wrong.
The antibiotics could do the same thing.
Could, not will.
We tried, we see.
The antibiotics will bring back the pain.
Pain makes us make bad decisions. Fear of pain is almost as big a motivator. Look, we still have time. I will do that biopsy if I have to, but not a moment before.
Go away.
Give me time.
We're out of time.
An hour.
What does out of time mean?
His O2 stats are 94 right now. As long as they're above 90, danger of fatal arrhythmia doesn't increase.
So what? There's no point in waiting.
You were right. We should be cutting into a corpse's head.
Yeah, we should be, except the CDC's got the cop's body under...
There's got to be other bodies.
You think this thing has killed other people?
No. That apartment was a dump. Just because Steve McQueen didn't get sick doesn't mean some other vermin didn't. You give me an hour, I go back there, I find a dead animal, I cut its head open instead of Foreman's.
Foreman's already on 100% oxygen. Once his O2 stats hit 90, I can't wait any longer. Where's your suit?
Either you'll find the answer, or I'll find the answer. Doesn't matter.
House.
We tested the wrong water. He stole cable, he stole fertilizer, and he stole water. It's riddled with malaria.
I know.
You already did the biopsy.
I thought I had no choice.
Anthrax. So what, you think there were terrorists in that attic?
It's a naturally occurring bacteria. We believe it was in the insulation.
How sick is he?
Anthrax is very dangerous, but we've caught it early. He's on Levaquin. It's the best antibiotic we have.
Lisa, you buy this?
Jeff, you've helped our hospital a lot. I wouldn't have assigned Dr. House to your case if I didn't have every confidence in
Then
him.
who's this guy?
Jeffrey?
There's all these weird diseases that can cause a rash. What about leishmaniasis or filariasis?
Where'd you hear about those?
Internet. I did some research.
Well, those are very rare conditions.
Oh, and anthrax grows along the interstate?
Leishmaniasis doesn't cause pneumonia, and filariasis...
Just look into everything. This is my son, all right? And I'm gonna stay on top of you until I know he's safe.
Didn't expect anything else. Everyone's a doctor.
It's breathing. It's on the inhale.
What does that mean?
Means his airway's closing up.
Is the anthrax doing it?
All right, hold still, Gabe. This is going to be a little uncomfortable.
We've got you. It's okay.
Nodules in his throat.
Airway's included.
We've got to intubate. Ativan.
Pushing 3 cc's.
Airway's too tight.
What's wrong? What's wrong? No, you're killing him!
Jeffrey, lift him to their choke!
Airway's too tight. Give me a smaller tube.
We're traking.
Smaller tube.
His lips are cyanotic.
Oh my God, he's not breathing.
Foreman, we're traking.
No, I can do it. I'll get it.
Foreman, you're not getting through.
He's not getting air. Oh, we have to trach him right now.
No, I can do it.
Betadine. I'm doing this.
Got it.
okay.
Allergic reaction to the antibiotics?
I don't think so. We switched to rifampin and there was no change in swelling.
We should try another
You really
antibiotic.
think he's allergic to 2 antibiotics?
I want to know what Dr. Chase thinks.
It's possible he's allergic
Oh,
to
I'm
both
sorry. Not you. Understandable mistake. The other Dr. Chase.
No masses, no fibrous tangles, nothing. It's not neurofibromatosis.
Doctors Chase are 0 for 3, even when they agree they're wrong. So, next, what else could cause neural damage as well as all the nodules?
Berger's disease.
He's never been out of the country.
Have his parents? They could have brought it back.
I don't think so.
Doesn't matter. His lesions are in the wrong place. His feet are the one clear spot.
Kid's dad mentioned leishmaniasis.
Yeah, and filariasis, but the throat nodules still don't fit with that.
These 2 diseases pretty much exclusive to Southeast Asia. What if the anthrax didn't set off the second disease?
We're back at coincidence again?
No. What if something else was the trigger?
Nothing else happened.
We happened.
Antibiotics?
We've been through this. It's not an allergy.
I gotta pee.
What did the CT scan tell you?
Nothing. Ow! Scale from 1 to 10. How painful?
Not half as painful as when a punch in the face.
Don't do that. It'll hurt you. Carpal tunnel surgery obviously didn't work.
Who are you?
The little ones call me Uncle Greg. Your dad never had carpal tunnel. You mentioned 2 obscure diseases to Dr. Chase. How'd you know about them?
I read about him on the internet.
So what'd you search for? Diseases from Asia that don't match my son's symptoms? You heard about them in Asia.
I've never been there.
Well, you probably just forgot. Let me refresh your memory. Some remote, dusty village, close quarters, at least a year. Starting to come back.
Calling Dr. Cuddy.
Excuse me, what does this have to do with our son?
Your dad's pissed off. He should be. Comes here expecting us to do an extra good job because he gives a whole lot of money to this hospital.
Don't talk to my son like that!
Just telling him my job, my obligations.
Stop! What's going on?
There's only one thing you guys have got to do. Tell the truth, or your son will die. How long were you in Asia?
Jeff, it's a simple question.
Two years in India.
Why would you lie about something like
It was
that?
87 and 88. This guru, I thought he had some answers. I went to his ashram and ended up with no money and no answers. I was embarrassed. I didn't want anyone to know.
No. No, you were a test pilot.
I'm so sorry, Gabe.
What does this have to do with my son?
The human heart is a giant muscle, squeezing or contracting over 60 times each minute. That's 3,000.
At this point, your blood is a deep purple because it's just finished dropping off oxygen for all the parts of your body.
The heart.
Come on, follow me. Come on.
Ian, I have a question and I need to go to the bathroom. Which would you like to do first? Question. Okay. Where's the bathroom? Who knows where the bathroom is? I do. Go with Ian to the bathroom. I don't have to go. We're not at school. Nobody goes anywhere by themselves. Why? In case you get lost. In case somebody kidnaps us. If somebody kidnaps Ian, they'll kidnap me too. I want to stay with the class. Michael, go with Ian. Ah! Do you need help? I need you to find a grown-up. Is the baby coming? Who should I take with me? You're fine. Go to the front desk or find a security guard. I really have to pee. Oh, God. Is the baby coming? I don't know how to do this. You okay, Ian? Yeah, sure.
think you are. You're bleeding. Help! Help!
Follow my finger with your eyes.
How much longer will Dr. Cuddy be?
Given the number of mojitos she's knocking back at the party, I'd say it's gonna be at least 3 hours before she's even conscious.
Weren't you at the same party?
I don't drink. I want you to reach out and grab my cane.
What's wrong?
Your son's brain is losing control of his muscles.
Dr. Cuddy's message said it was just dehydration from the diarrhea.
She's wrong.
Is he gonna be all right?
I don't know.
Paradigm Chester is an abnormal growth of some of the cells that fight infection.
Is that cancer? Because he seems okay now.
Yeah, the other doctor kind of scared us about that.
He shouldn't have. We're just testing. It'll probably be negative.
I don't understand. You don't think that's what it is, but you want to do this thing to him anyway?
We need to be sure.
Isn't there any other way?
It shouldn't take long.
Those ridges look a lot like purple papules.
They're not purple, they're red. Probably just blood blisters.
Give me the biopsy needle.
What'd the test say?
Colonoscopy was clean. And the biopsy was negative for Erdheim Chester.
So Ian's gonna be all right. It was just some sort of virus.
What's that?
Urine.
Oh, but it's brown.
Ian's kidneys are shutting down.
Still think it's not the same case?
I'll shut the blinds.
I'll let him watch. I'll do my best work on the big stage. Passing through the superior vena cava.
You're in the atrium. Pull back. You've hit the wall of the heart.
These procedures would be so much simpler if you could do them on healthy people. And out again.
Deep there. Cardiac arrest. All code.
Come on, paddles. Come on.
Charge.
Clear.
Code blue, ISO room. Code blue, ISO room.
And again.
Nothing.
Again. You got a clock on this?
How much longer are you gonna keep doing this?
Clear.
Wait. I've got something.
He's back.
What are you doing?
What we came here to do.
It almost killed him.
I know. I was right here. Give me a Vacutainer.
His brain's been oxygen deprived for over 8 minutes. There might be nothing left. He might
Tell the parents. Who the hell is that Vacutainer? So, anything else? Or is it just these 7?
Drop it, House. She's right.
No, she's not. You know she's not.
We should have called her.
I'm surprised you didn't.
You're gonna have to find a way to let this go. We can't go near Ian.
We don't need to go near him. We have his tumor. Cuddy may be right that we screwed up the protocol. She may be right about my screwed up obsession. But I'm right about the medicine. How many tests can we do with that? Look, we cure the kid, we solve everybody's problems. How many?
Maybe 2 good pieces.
How many okay pieces?
3'd be pushing it.
3 tests, 7 choices. Okay, what's first?
sarcoidosis seems most likely.
Yeah, so likely Cuddy's gonna think of that all on her own. She's got the kid's whole body to play with. Let her do that test. What's next?
It's moving too fast to be spreading. It has to be growing from something that's already there.
Genetic disorder, tuberous sclerosis.
Or it's his immune system, histiocytosis.
Well, there are more documented cases of histio amongst older people than tuberous sclerosis. Let's start with that.
Wing or drumstick?
Gonna need a little more than that.
A little more is more than a third.
If we have to repeat this test because you didn't cut us enough.
I'm adding 1 microliter of the immunoperoxidase.
Make it 2. I don't want House biting off our heads because we weren't sure if it turned red or not.
That's definitely not red.
You want me out of here?
You come up with anything?
No. Test him for Erdheim-Chester disease.
Erdheim-Chester, that's not even on the list.
Because we already did it. He tested negative.
So did Esther.
Disease lied.
Yeah, the tumor's got it in for you. Diseases don't lie.
Fine, it didn't lie. It's slow platus. We biopsied the colon. It hadn't reached the GI tract yet. It's there now. It's in his liver, his lungs.
You want it to be there. Because then you didn't screw up 12 years ago.
We can't waste our one test on the one disease we know it's not.
Run the test.
Sure about this?
Wait, let me think about that. Don't pressure me. Just run the damn test.
Cells look like macrophages.
That's a good start. Take your time and say it loud.
CD68 positive.
Start the treatment.
Hannah? Hannah? What'd you do?
I just wanted to sleep.
I'm calling an ambulance. I'm injecting a dye, which will allow us to take a look at your retina and your optic nerve.
Everything's kind of blurry.
Normal because of the dye. It's going to be that way the next few hours. She's asleep.
Normal stage 1 brain waves.
She's better?
Still blurry.
You fell asleep.
No, I didn't.
We're not here. We're skiing. It's Thanksgiving at Vail.
You want me to think about nearly killing myself on a snowboard?
Come on. You never fell. You were awesome.
Is that what you told him? I'm hysterical and I need to relax my anus?
I told him, how many cases do we work up in a year? They're all weird. He could have written up any one of them.
She's bleeding.
I can't breathe.
Hold on.
Looks like the problem is some sort of infection. Probably caused by hypotension, shock the liver.
We should start broad-spectrum antibiotics.
Yeah, you might want to add some chicken soup. It'd be just as useless, but it's got chicken. We need to know exactly what kind of infection we're dealing with. What infection causes sleep disturbance, bleeding, movement disorder, organ failure, and abnormally normal white.
The bleeding, it looks more like leptospirosis.
Without conjunctivitis and elevated creatinine?
What about typhoid or some kind of relapsing fever?
Makes sense if we were in the Sudan.
You sure she hasn't been out of the country?
She hasn't even been out of the state in at least a year, neither has Max.
Maybe she lied. You talk to her friends, neighbors?
You don't know? Come on, if you don't stay up to date on my notes, where's your next article gonna come from?
Talk to the dog?
We're not as up on foreign languages as you are.
Has the dog been traveling?
It came from a breeder.
Where?
I don't know. A place called Blue Barrel Kennels. They only had the thing for like 2 days.
Blue Barrel is a kind of cactus. You see many cacti in Jersey? Want to see a magic trick? Oh no! Where'd it go? Where'd it go? Is it here? No. About here. There it is. Oh, it doesn't look anything like a nose.
That wasn't there this morning.
And call a CDC.
Tell them what?
That we have a patient with the plague.
The Black Plague?
Looks that way.
Plague's carried by rodents, not dogs.
Where there's dogs, there's fleas. If they hail from the southwest, and those fleas can't tell the difference between prairie dogs and puppy dogs. A small percentage of plague cases present with sleep disturbance. Imagine an idyllic river of bacteria. It's not idyllic for her, but it serves my purposes. The steroids and the immunosuppressants acted like a big honking dam across the river. Physics 101, put a dam up in front of a raging river, the river rises. By stopping the immunosuppressants, we blew up the dam, and a 100-foot wall of bacteria flooded her lymph nodes.
We better find out where that dog is now.
After you restart the immunosuppressants, and fill her up to the eyeballs with streptomycin, sulfate, gentamicin, and tetracycline. Use a garden hose if we got one. Get yourself some prophylactic treatments as well.
I've got the plague.
Don't worry, it's treatable. Being a bitch, though. Nothing we can do about that.
Julie, surface now. Help! Shark! Please don't scare me like that. What? You said we should bond. Look what I found.
You're not supposed to take anything off the rack.
How cool is this? They kind of look like feathers. Can I see? Ow!
Get her a towel. What was in that jar?
Why the hell do you guys have us quarantined in here?
We're just taking every precaution.
Against what?
What do you think I have?
One possibility is tetanus from the glass jar that sliced your hand.
I remember tetanus shots. That does not look like tetanus shots.
It's really not worth going into because the odds are astronomical. Again, it's...
Smallpox. Smallpox? Vaccine will protect you if you don't have it and lessen the severity if you already do. But it's 1 billion to 1, so we don't want you to panic or anything.
Sorry. I have to get the needle behind the bone.
I'm running out of bones. If this is a waste of
Last
time...
one. We just have to be
What? What is it?
I'm sorry. I have to call the CDC. I think you do have smallpox.
Am I gonna die? I mean, this is what terrorists want to use to kill everyone, right? Like, there's no cure.
There are treatments. We can give you Cidofovir.
I don't think you care about the drugs' names. Bottom line, it's 30% fatal, which means your chances of being okay are about the same as a basketball player's chance of hitting a free throw, unless she finds dark purplish skin blotches,
What would purple blotches mean?
Hemorrhagic type smallpox.
in which case her chances are more like Shaq hitting a free throw.
No purple skin, but take a look at this.
What is it?
There's a rash under your daughter's arm. Like more of those gross bumps?
No, it's just a regular rash.
What does that mean?
It's just not smallpox.
Please, step out of the room. I'm Dr. Broda, head of infection control, CDC, and your protective suits are not adequate.
Turns out they don't have to be. Rash under the arm means it's not smallpox. False alarm. Sorry. Hope the traffic wasn't too bad.
Rash is consistent with smallpox.
Not if it presents after pustules.
She's probably just allergic to the bed sheets or the hospital gown, or you simply didn't notice it. We're going to airlift blood and tissue samples to Atlanta. We'll have the DNA results in 18 hours. In the meantime, please, step out of the room.
You brought the plane? Cool.
Meningococcus. We believe the rash under Julie's armpit is actually petechial spots. When added to the high fever, the vomiting...
There haven't been any seizures, no stiff neck.
If I could just gain access to the patient, I could investigate the rash further.
All right, I'll take a look.
I can weigh your gear. I'll take every necessary precaution.
You come to me with a weak diagnosis. I even offer to investigate, but that's not good enough for you. What's really going on here? Sir, are you feeling all right in there?
It's just a headache.
Baby. Baby.
Oh, God.
Dad, you're bleeding.
Somebody, please!
Get in here now.
This is not meningococcus. You're not getting in here.
I just want to look at the rash under her arm to see if it's matured.
You
to
can
match-
look through the glass.
I need to be closer. If the pustules are at a different stage...
She's comfortable. We're gonna have our results back in 8 hours. If it's not smallpox, you can be the first one in there.
Why are you just standing out there?
I'm just trying to help. If you're feeling up to it, can you sit up and show me the rash under your arm? Wait. The soles of your feet. There aren't any lesions.
Who cares? Everywhere else, this is torture.
What's more likely? He got smallpox the day after we immunized him for it, or he's sick from the vaccine itself?
You got any proof the kidney cancer's back?
Well, let me give him this. When he gets better, that'll be the proof you need. I'll put on one of your fancy space suits, and I promise I won't kiss him on an open sore.
You know who Janet Parker is? In 1978, she was working at a university in England. Someone in a research lab on the floor below screwed up. Some smallpox virus managed to float up through the vents into the room where she was working. She died 4 days later. Last known person to die from smallpox. And the person in charge of the lab was so destroyed, he killed himself. Now that he's shedding, I can't open that door for anyone.
Hey, look, there's the proof you need. There's blood in the urine bag.
His kidneys are shutting down. He's in the final stages of the disease.
Smallpox was causing the kidney failure. The blood would be brown. It's red because the kidney cancer is back, and this is not smallpox.
I'm not opening that door.
Well, that makes one of us.
Hey! Hey! You're insane!
But I'm right.
I hope you are. Because I can't let you out now.
House, you have to examine the body.
I'm not going anywhere near it.
Look for escars, hurry.
You think it's our pox?
The captain had a cat. He lost his fur and then died.
Step back, Dr. House.
It's kind of hard to do an autopsy in oven mitts.
Take him off.
Says the woman standing behind 2 panes of glass.
Do you believe me? Forget me. Do you believe you? You think it's rickettsial pox, don't you? If it is, it's curable, and she's gonna die unless we can prove it.
You really are annoying.
Come on, House, come on.
Escar. Escars.
Start the girl on doxycycline right now.